What's up, FRT community? RTalk episode 3 starts right now. I've got my very first student to ever join on this segment. You're not going to want to miss her study tips. Let's dive in. What's up, future respiratory therapists? Today we have episode 3 of RTalk, and I'm joined and glad to be joined by my very first student. Today we're joined by Rebecca Bircher. Rebecca, I'm going to give the floor to you. Feel free to introduce yourself to basically include whatever you want to.
Thanks. Hey, Coach. Thanks for having me. This is cool. I am a little bit of an older student. I'm 48 and a single mom, and decided to do something different with my life for a better future for both of us. And this is I'm really excited about getting into respiratory therapy. Really
nice.
And nice. I graduate in May, so it's coming up.
Right around the corner. Fantastic. Now, you know how this works. You talk, I'll write, and then we recap at the end. That's pretty much what happens. So feel free, let the words flow, and we're all going to enjoy the show. Okay? So my very first question for you is simply this. Of everything you could have done, why respiratory therapy?
Oh, man. Well, I always knew that healthcare was the place to be for me, because I'm a people person, I think, and I care a lot. And but I didn't want to do nursing, and that's just my preference. Like, I didn't want all that nursing does. And I'm so happy with, kidneys up. Like, that's great. There's other people to handle things from the kidneys down, and that's just not this girl.
Yep.
So I got into that for really those two reasons, but also because I have a lot of, obviously because of my age, I see a lot of older population coming into my life, and I'm seeing that there isn't really the care that I would like to see available to the geriatric patient population. And that really became something very special for me. And it was actually a couple of years ago when before I did this, while I was going to school, I was clean. I still kind of do. I clean houses. You know, it's a flexible job. It's good money. And, but one of the people that I was cleaning for ended up going on to hospice. And the hospice nurse said that she got into nursing at 52 so that she could just do hospice. And that was something that just stuck in my head, because I thought, oh my God. And that was when I was just cleaning houses. And I thought, man, it's not too late. It's not too late to really make an impact. And being with that gentleman, which became more caregiving than it did housekeeping, with him on the day that he died, it was an honor. I was there the day he died. And I just really felt like I wanted to do more of that. I wanted to be there for people in the aging population, so that if I can help them with their very last breath, that's really cool. That's cool for me. So that's why I did.
I'm actually going to put that up here, and you'll know why here in a second. All right. So I love that. I love your story. I love that respiratory therapy creates this opportunity for people who have a very specialized interest like yourself. I don't know if first of all, public awareness for respiratory therapy and younger people coming in and searching for a career, they say, I want to go into healthcare. And you kind of touched on this. It's like, oh, do I want to be a doctor or a nurse? And both of those are wonderful things to be. We on this channel love all of our nurses. We love what they do. It's just not what we aspire to do. And there really are so many other options and avenues to go in and be able to impact a person's life beyond just the two big nursing and doctor realms that seem to be, probably because that's what TV emphasizes and glorifies. It just seems to be like this lost element of all the health sciences. We're not even talking respiratory therapy. We're really talking, physical therapy, occupational therapy, radiology technology, all of them, ultrasound. There's so many fields. And so I'm glad you found one that fits your mold and excites you about the future. School. What's we didn't talk about this, but what was the hardest class?
What was the hardest class?
Yeah.
Uh, um, well, anatomy and physiology was interesting, but very difficult with all the memorization, because it's just hard to just pack all that in. It's just really hard. And you know, when you're doing things like that it's important. It's not just something that you can memorize and then brain dump. We all know that there's classes like that we can just kind of hold on to it for a minute and then let it go. But those things you really do need to be able to retain so that you can articulate and understand appropriately with the people that you're working with. So that was tough. It was tough. And I did the first one in a summer session. So it was a 6-week cram and it was insane. It was really a lot of information. So.
Right. So yeah, and specifically when you start talking about, because I'm sure in your program you had a cardiopulmonary A&P?
Last semester, yes, but this was just general A&P.
Just general A&P. So I do want to touch on something you said there, because you made a very good point. Everything else builds off of A&P, whether it's the most basic A&P or A&P2, or even your specialized cardiopulmonary A&P. Everything we do builds off of that, and you don't know how many times students are struggling to try to grasp like mechanical ventilation. A lot of students have a hard time with that course. A lot of students have a hard time with hemodynamics, pulmonary function testing. Those are a lot of the subjects and content that I traditionally see students struggle with. And when you really get down to the root of it, it is because their foundational understanding of anatomy and physiology is weak. And it all has to start there. And that's why we do what we do. So I appreciate that very, very much. Before we get into talking more about the clinical side of things, I have one more question for you from just how to be successful as a student. What are your tips to any respiratory therapy students out there right now? What are your, do you have any tips? What's your best study tips for those people?
Well, I think that you really have to embody the fact that you're going to eat, breathe, and sleep respiratory. Like, you just have to understand that you have to make that a priority. And it's not saying that like you have to, because people are going to say that to you, but you're going to realize at a point,
right,
that you're going to have to start sacrificing some things, like watching too much Netflix. Like, you're not going to, you're like, man, I'd love to sit down and watch a movie. Study, so there's those kinds of things. So I think the best thing to kind of keep in mind is that it because you're passionate about it, you're going to want to learn it. That's the difference too. I have a 13-year-old, and he couldn't care less about some of his classes, but I get so excited that I'm sitting here learning stuff, and he's like, oh, what is wrong with you? I'm like, no, it's exciting. I'm really interested in the
right,
flow of blood through the heart. But you really have to use every opportunity. I would think this would be my advice, is to use every opportunity that you have and seek out those little moments of opportunity. Like, I hate to say it, but I'll ride around on the riding lawnmower while I'm listening to respiratory therapy things. And in the car and in the garden, and even when I'm cleaning, I will stream. I'm sorry here, coach, but I'll stream your videos, because the thing that's great about your videos, and, just has to be humble here for a moment, is that they're great for repetition. So I might watch them, and then I get the visual of what you're drawing, or what you're trying to do in visually. And then I can listen to it again and again and again and remember what you drew. I can have that in my mind and just hearing your words. So I think, geez, it takes me 45 minutes to ride the lawnmower. I can listen to an hour of you, or I can listen to 8 minutes of you, over and over again. And if I take away one thing, if honestly, we all do it with different people in our lives. If I hear coach's voice in my head one time, it was worth the time that I spent. So I do it in the car. I do it while I'm cleaning. I do it on the lawnmower. I do it in the garden. I do it while I'm cooking. and I just do it.
Yeah.
I sometimes bring my wireless speaker in the bathroom and do it while I'm showering. It's awful. It's awful. It's awful.
Yeah. I think what you're trying. I think what you're trying to say here is you're getting these students to and other students who might have struggled trying to find time to study to realize that there's always time to learn, especially when you're in those medial tasks or those tasks that have to be done. But it doesn't mean it can't be playing or something happening in the background.
Right. Especially in your car. There's so much time in your car just driving back and forth to places. And it's really great. We now have that ability to connect and do that and listen to podcasts over your car speakers, which is fantastic.
Yeah, absolutely. You said something when we talked prior to this. You talked about, you said something, I wrote it down. It said, touch everything you can. What does that mean?
That means when you're even in the classroom, because we have a really good lab, but especially when you're in clinical, is to touch everything that you can in clinical with like the ventilators. If you're, in the lab, we're like, take it apart, put it back together, take it apart, put it back together. And so when you have the ability to touch a new ventilator or see how it works, to run a pre-use check on it, even though it's already got a pre-use check, do it again, learn it, because when we're nervous and we're tasked to do that on the fly, we're going to freak out and get nervous. So the more we do it, I remember the first time we had to change an inline suction catheter and everybody stumbled. They were like, what end is and we'd done it, felt like 100 times, but we stumbled over it when we were right in front of the patient. So it's put your hands on it as much as you can, do it again and again and again, and observe any procedure that they allow you to observe, even if you're just watching from the door and you're not allowed in the room, because then you just become more comfortable being in that space, and kind of people become more comfortable with seeing you present as well. So if somebody says, oh, I'm the respiratory therapist, but I'm a student and I'm just going to watch from the door, that's okay. So you're not stepping on anybody's toes or in their space, but you're observing and you're learning how they relate to each other and the equipment. And so you can kind of feel it out. So yeah, I think touching everything, learning from everything that you can to familiarize yourself with it.
That's really good advice. And you said you said the key word or the key words when you said, when you're nervous, you're going to fumble. The only way to prevent that from happening is muscle memory and repetition from as many times as you can do it prior to that time becomes a point of being scared and nervous, because that's natural. Every student goes through that. But you're right. If you've done it, boom, 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 in lab or in class or any free time you have, I see students who class is over, is up and out. And then there's always seems to be a few students who are up and in the lab, and they're doing exactly what you're saying. They're just touching, they're just working with equipment that they want to be more familiar with. And that's really good, really good insight, to have and to give, to take away if you're a student watching this. Okay. COVID has really messed things up for a lot of people like you in your shoes. One thing you didn't touch on that you mentioned previously was the support system.
No, yeah.
Now, I want you to talk about support system for just a second, but not just while you've been going through school and dealing with all these disruptions with COVID, but also look forward to what you expect after graduation as you begin working in regards to the value of a support system.
Yeah. Yeah. Well, see, and I'll digress just a bit. I never would, for the reasons already spoken, I didn't even want to consider something like nursing, only because I've seen my friends who became nurses. I have several that are older students like myself. And I thought, y'all are crazy. That's a huge time commitment. Who wants to be looking at flashcards while they're at their kid's basketball game? And I just didn't realize at that point that respiratory was just as demanding as nursing. I had no idea.
Yeah.
So I really, when I figured out that I had bitten off a big chunk that I needed to chew, I really relied a lot on my family to help me. And because I think it's really important to have my mom there to pick my son up from school, have my ex-husband there to keep him an extra day when I needed to have study for exams and that type of thing. I really needed to be honest enough to ask for help when I really needed it. And I've needed it a lot. So I feel like in my position, it's taken a team to get me here. You know, they say it takes a village to raise a child. It takes two villages to raise a Rebecca respiratory therapist. I tell you what, because I couldn't have done it without the support of my family, my friends, even my son, who understands that when he wakes up at 6 o'clock in the morning or something, and mom's already sitting there with her books out in front of her, that he recognizes that he supports me as well. And then after that, like, I think the support that would come after that is really, it's a little bit more touchy. But I think probably the support that you need afterwards is finding a good facility that's going to let you be the therapist that you want to be. You know, finding during your interviewing process, you find out like, well, how I want to be here to support you as a facility and as a respiratory therapist, but honestly, how are you going to support me if I see things that need to be changed, if I see things that don't go exactly how I think they should be going, if I see procedures that I feel might be done, you know, incorrectly. It's really it's a slippery slope. You got to be real careful on whose toes you step on. But I think it's really important as a working new respiratory therapist to decide what kind of therapist you're going to be, and then be able to have support in that way after graduation and after finding a job. I think that's a really important part of picking your facility, is to find out how they're going to help you when you come across an obstacle.
Yeah, I think that's great insight. I like to hear that coming from a near graduate, a student who's about to graduate. I'm glad that you are aware and recognize that you're going to need support. You know, you said something yesterday when you said, you know, the learning doesn't stop. The learning is going to continue. And this support system that you're going to go into after graduation as a staff therapist, you're going to join a team. And really the support you get from that team is probably ultimately going to play a major factor in the therapist that you become. So I think seeking that out is wonderful insight. Let's talk about clinicals here for just a second. When you're at clinicals in the hospital, okay? First, let's just do this. What's your favorite part of clinicals?
What's my favorite part of clinicals? When patients don't extubate themselves. No.
Yeah.
Oh gosh, I don't know. Like my favorite part of clinicals is when you see everything happening as a whole. Like when you're able to stand there and even watch when the residents or the physicians are doing rounds, and you can understand what's going on. You're not just standing there going, I don't know what they're talking about. Like you can really hear and feel the scenario. You can understand what's going on. And that's a beautiful moment in your education where you understand on a whole what's happening with the patient and on different levels. I mean, I'm never going to know all that. I'm never going to know it. No, I'm not going to know their job. They may not know mine, but it's nice to have that feeling of sitting, standing or whatever and going, hey man, I get this whole picture, like the whole picture. That's incredible. So that's my favorite part when that happens. But even just seeing things, learning things that you didn't even know you didn't know. Like there's that point where you're writing, like we're all writing down vent numbers to, you know, and you're focusing on just those 15 settings and you're writing them down and you're charting them, and you don't you don't know why you're doing it initially. You're just knowing that you're doing it. And then there's that moment when you, again, you can sit back and say, wow, I understand how the ventilator works as a whole and not just 15 settings, you
Nice.
know. And when it starts to, like, the light bulb starts to click in your head and you go, wow, if I change this, then I am changing their tidal volume. Wow. You know, and that type of thing. So when it all starts to come together, that's incredible, because in the beginning, we don't know certain things, but at the same time, we don't know why. We don't know why.
Right.
We don't know why we're not getting it. We're just kind
Yeah.
of trudging in and saying, I don't know why I'm doing this, but I'm doing it. I don't know why I'm doing it. But then you come to a moment where you stop that, where, you know, when you don't know why you're doing something, you don't know why, but then that stops, and then you do know why, and you see it, and that's a beautiful moment. But, you know, I think that that's a generalization answer to your question, like, what's my favorite part of clinical? But, you know, my favorite part of clinical is when you walk in and and people say hi, and you get to see your patient, you get to see patients, you know, when
Yeah.
you get there and you get report, and you're like, who's my patients today? What are my patients
Yeah.
today? I love that. Like, you get to be a part of the story now. You're not just on the outside. You're
Yeah.
actually part of
Man,
it.
you're giving me so much to write here.
Good. It's about time teachers start writing more. Students have been writing a lot,
So,
happy. Right.
light bulb moments. When you
Mm.
said that, and you're talking about the whole picture coming together, when you say light bulb moments, I literally got chills. I say
That's
this a
funny,
lot.
because it sometimes it gives me a feeling in the pit of my stomach. But that's fine. I'm glad you got chills.
No, I think for all you students out there, when something becomes clear to you, your educators can see it, and these are, we call these light bulb moments. And I think for all true educators out there, I think we live for light. I think we teach for light bulb moments, because it's just it's the pinnacle for me. Going, I've I have played some role in this student learning a bigger concept, and it's truly one of the best feelings, I think, for students to go, you can see the happiness on their faces, and I enjoy it on the inside. I usually get chills every time. Also, let's talk. We're going to talk about clinicals here for just a little bit longer. And this message is kind of going to be a little bit about more geared towards, I want some of the therapists that are watching this to maybe get a perspective on something. So when you're at clinicals, depending on what facility you're at, are you aware, and are you seeing when things are done good or when things are done bad?
Yeah. Yes. Definitively. Yeah. And it's hard. It's hard to see it happen, because you don't know what role you play as a student, and maybe as a new respiratory therapist. You don't really know the role you play in identifying that, more than just outside your head, and correcting that, and not showing up and looking like just the new kid on the block who is just being a pain in the ass, you know, like,
Right.
what do they know? They just got here. This is the way we've been doing it. This is the way we do it. And things like that. So I do see it. I do. And it, you know, I don't know, we kind of call that sometimes, you know, the pucker factor, where you're like, oh my God, that could have gone badly, and we're just glad it didn't. So yeah, you know, and I feel like that's with everything. Like, that's with everything in life. But you have to have a certain. I believe that comes back to where you were saying about finding a facility that will support you. So if I see that, who do I go to? Who would I go to who's going to take that and respect what I see, versus just blowing it off? And how do I do that? And so I think that's really important. But yeah, we do see things that are done inappropriately. Whether you want specifics?
No. That's
No,
good.
no, I mean, like, you know, like, just certain things, you know, not by certain people necessarily,
Sure.
but just certain things. Yeah, we see.
Yeah. What's your game plan? Like, how do you, as a student, how do you prepare yourself to go out into this profession and be resistant to adopting those bad habits?
Oh, uh, yeah, right. Well, I think it is about coming into it with that understanding with your facility, with whether it's your supervisor or the director or of the respiratory, or even if you're interviewing with the director of the facility, you have to kind of lay that down and say, if I have a problem, who's my chain of command, and how will they be perceiving this if I come to them and say, I'm seeing this. And I'm the kind of person, and I guess maybe most people who are in this field are probably the same way, is if I see a problem, I'm just not going to just identify the problem, I'm going to also offer up a solution.
Right.
So it's not just about saying, oh, I saw this happen and it was baloney, but I'll be like, but what if we did it this way instead? How could we do this to
Yeah.
make it so? And I think that would be probably my first line. But if someone is trying to tell me that the way I'm doing it, the way I was taught to do it, is the wrong way, I'm just gonna say, well, that's the way I was taught. This is how I was trained,
Yeah.
and just let that be. And if someone is going to complain about me on that, I have everything to fall back on. I have the text, I have the data, I have the new education, I have everything that I need to if I needed to
Right.
prove that I'm doing it the right way.
Right.
And I think that, however, that comes, maybe it's because I'm older, but I think that comes with a level of confidence to know that it is okay to speak up when something needs to be spoken up about. The world isn't going to end, and people aren't going to hate you if you stand up for something that you truly believe in.
Right.
And you would feel a lot worse if you didn't, and then something did go bad, and your name's on you're the last one who charted on that person, and they're going to come to you.
Right.
So I think that you really, and even if you do it and then you go back and you talk to somebody and say, hey, I did this and this is what's happened, so if word gets back to you, I just wanted to kind of let you know this is how it went down, just so
Right.
you know. I think that would be it.
Yeah, I like that. I like that a lot. We're gonna end on what your thoughts are from a fresh mind. I love talking to students because you have so much energy and you have fresh eyes on something that a lot of us have been doing for many years. So let's talk about the future.
Mm.
What would, as you go out and prepare your career as a respiratory therapist, where do you see the future of respiratory therapy?
Oh my. Well, I always like progress. I'm not a person who is is happy with
Yeah.
stagnant.
Right.
Um, you so I think that there's so much that's always changing in respiratory. Like, we're always getting uh, new protocols that we can instill. We're getting new therapies, new equipment, new technology, and I would really like to see things continually progress in that area, and open things up, because there are, knowledge bases open, because there are things that we don't use, I think, that we could use to broaden, like, the spectrum of equipment. Like, we use it for this one purpose, but it could do 5 different things, but we only use it for this one, in this one setting or in this one way, and that type of thing. I'd like to see things broaden up that way, but I'd also like to see things more specialized, where therapists can really get into the cardiopulmonary A&P part of our training, where we're really focusing on not just the lungs, but all of the life functions, perfusion and ventilation and oxygenation, yes, but also circulation and perfusion, because that's really, really important. That's the cardio part of it that I think we should really be more a part of. And I would really like to see that advancement for students having that opportunity and being considered more of a specialty than just something that we come in and give medication and that type of thing. Like, we're so much more than that. And I
Yeah.
would really like that vision to change just a bit as to what we can do, because we learn so much. And then the reason why everybody says, you know, you learn so much, but then you lose it. Well, why are we losing it? It's because we're not utilizing it. Like, we shouldn't be losing what we're learning. You know, we just shouldn't be, but we do. They say, oh, you're going to use that, and then you'll learn it and you'll never use it again. Well, why not? You know, like, I'm trying really hard to memorize these formulas. Why am I never going to use formula again? You know, so that happens a lot. Like, people say that, oh, you're going to learn it and you'll never use it again.
Why?
Why?
Yeah.
So I'd like to see us more using our education, because we've got a fantastic education in the respiratory therapy system. And I'd like to see that utilized more.
Yeah. Perfect. Fantastic. So I'm going to recap now, and then we'll shut this down. Just let's start back where we just left off. Use it or lose it. If you don't use your knowledge, you will 100% lose it, just as Becca stated. And you're exactly right. Why do we lose it? Because we end up graduating, going to work, and not using that knowledge. Those formulas become some distant thought, as opposed to a part of our daily routine that can help support patient outcomes. So 100, use it or lose it. Hey, all you therapists out there, students are seeing your good habits and your bad habits. So be and make a choice to be an influence of positive, good habits. You don't want to be the example of bad habits. I love the way Becca said that she's just allowed to be part of the story at the beginning of clinics. Just one of the most exciting things is getting her patient and just going, man, I get to be a part of this today. And I think that's the human element of healthcare that sometimes tends to be missing. So just to be a part of the story is 100% true. You know, I ask students all the time, I say, how come you don't ask questions? And the reason they don't ask questions is they don't know why they don't know why. You don't know what to ask if you don't even know what you don't know. And that's really a true statement. So you have to keep digging to perpetually figure out what you don't know, so then you can ask those questions. That's exactly right. Light bulb moments, when the whole picture comes together and you're no longer just jotting down numbers. When the whole vent and the whole patient and the whole system and the vital signs and everything comes to life and it all starts to make sense. That's the moment you're looking for, because that's when you can go, I have been learning stuff and the knowledge is there, and I am going to be a good respiratory therapy. Support systems, super important. During school, after employment, wonderful idea. Seek out a good support system. Touch everything you can in the classroom and lab and clinicals. Get involved so that you're prepared over repetition and muscle memory, so that when you get in that stressful situation, you have already touched it and played with it, so that it's almost second nature. Now you have to do is deal with the nerves. Learning to multitask was one of her key elements when she was talking about study tips. She's talking about, you don't have to sit in your room with a book on the bed. You can do that if you want to. But if you're looking for ways to study and to maximize your time, which all of us have the same amount of, on the lawnmower, in your car, at basketball games, at wherever it is, you have the ability to tap into resources, to multitask, and to use your time effectively to either listen, whether it's to me or to somebody. I don't care who you listen to. I just want you to learn. And you have to find those moments when you can multitask and do that studying while you're doing something else. It's never too late to make an impact, and that is so true. You've referred to yourself multiple times throughout this as an older student. I will tell you the correct term for that is a non-traditional. That makes you feel better, okay? But she is so right. It is never too late to make an impact. Never, not one single day at any point. And this is even for you respiratory therapists out there that may be burnt out and maybe just down and just going, man, I don't even know how long I can do this. I don't do anything. Nothing I'm doing makes an impact. Shift your mindset and realize that tomorrow you can go to work and make an impact. And guess what? Everybody always says, oh, management doesn't keep you from putting a smile on somebody's face. That's an impact. And that's what we talk about. We talk about making an impact. Having the ability to take care of sick humans is an honor, and it puts you in the position to make an impact on humanity. So take advantage of it. Geriatric population is Becca's love. It's her end game is to have a role in that field, in that area, because of her love for older people who are often tend to be seen as a burden. And you can read about this in text and in research and stuff. They talk about the silver tsunami that's coming with this aging baby boomers population. And it always seems to come back to being a strain and a burden on the healthcare system. And these people have contributed to our society their entire lives. And now we see them in this situation that's being created a burden. You're talking about my parents, probably talking about Becca's parents, probably talking about a lot of your parents. I don't like to think of them as burdens, and I want somebody to take care of them just like I'm going to take care of your parent or Becca's parent or whoever else. This geriatric population. Now, as we always finish up here, don't ever forget, average is easy. Don't be it. And Becca, you started off with a wonderful quote. If you can help with somebody's last breath, that's very cool. And that's the saying that's going to go on your shirt one of these days when you have some merch. Okay? That's a wonderful saying. It is such an honor and such a privilege to be a part of this and to be a licensed. For people to say, I trust you. I don't even know you, but I trust you with my life is such an honor and a privilege to be a part of. I thank you so much, Becca, for being here today. We're going to shut it down, but I'm going to give you the last floor for any last comments you have. And also let people, if you wish, if anybody looking how to reach you, how can they do so?
Oh my goodness. Well, thank you. Thanks. I appreciate that. And if anything, going back, what did you say? Non-traditional? If anything, I'm totally non-traditional. And so I really appreciate that. And you know, all I can say is that I keep my fingers crossed for all of us, because we are all in this together. And one little thing, if I can just show, this is something that I keep with me. I got these online at the big online store. And what this is, I know it's backwards, but this is meds. This is boards. There's 50 in a pack. This one is their O2 therapy and formulas and laws. So these are small enough I can keep in my bag or whatever bag. And so I work from this side and do therapy stuff, and you can work from both sides. So
nice.
You know, so I keep these, I fill them out and keep them in something. I have sets of them everywhere.
Yeah.
So that's something that I found to be really easy. So I didn't have to be wondering where my pack of flashcards were and that type of thing. So I use those a lot. So, but thanks, Joe. I mean, really, okay. I just couldn't, there's just people in my life I couldn't have gotten here without, and you're one of those people. And so I appreciate the opportunity to be here and thank you and say, you know, even though I might be graduating, I'll still be mowing the lawn this summer. So
that's right. That's right. So stay tuned.
Always something to learn from Respiratory Coach for sure. So.
All right, Becca, again, thank you so much for your time. Hey, everybody else out there, in the meantime, don't forget, go be great.